I just wanted to start off by telling you a little bit about my mum and how we got to where we are today. Mum was a Yorkshire lass, and she had a very deprived upbringing. Her father died when she was 1 years old, and her mother was admitted to a mental institution a few years later, which is where her mum stayed for the rest of her life. Mum started her working life in a munitions factory before joining the QAs and training to be a nurse, a profession she was really proud of. Mum had to give up this occupation when she got married, as you had to in those days. She had 3 children within 3 years, and after 10 years, her husband, my father, abandoned her. She worked at a tailoring factory to make ends meet and single-handedly raised her 3 children. She was too proud to claim benefits or ask for help. In her 40s, Mum decided to retrain to be a nurse. We were all in our teens and independent. Mum passed her nursing exams and began her dream job, where she met somebody called Ellie. Don't know if you've heard of her. I think she's around here somewhere. Little did I know, Ellie was to become my rock over the years. Here you can see just some of Mum's complex medical history. To summarise, Mum was living with bilateral leg amputations, a history of type 2 diabetes, peripheral vascular disease, arterial embolic disease, previous transit ischemic attack, hypercholesterolemia, got it, and idiopathic lung pipe fibrosis. In spring 24, Mum developed pneumonia, and I don't think she ever fully recovered from it. She was sent home from A&E after 2 days because there was no beds, and she was still very poorly at home. Later in the year, in November, she was admitted to hospital for the final time with breathing difficulties and reduced blood oxygen levels. I'm going to go back to the start of her care from 30 years ago. I was worried about Mum when she had to go to hospital in about 94. Neither of us had any indication that she might lose her legs. 3 years later, after consistent pain, operations and complications with her arterial system in her lower limbs, she lost both legs. She had one leg amputated, and within a week the other leg had problems and she had to have that amputated as well. So she received care by what I thought was one of the best hospitals in the country. Let's call that Hospital A. Her care at this hospital was really good, and I felt that the hospital listened to me and answered any questions that either me or my mum had. Mum was in her 50s at this time, and I was very much there as her daughter, not her carer. I remember when she was in this hospital for a number of weeks asking whether it was the right place for her, and shortly after she had a consultation with a hospital in London, Hospital B, where she was told the only option left was amputation. It was a big shock to her, but she seemed relieved at the thought of no longer having pain. After leaving this hospital, or after they wanted her to leave the hospital, she was taking up a high dependency bed, and we lived between 2 large towns, and we needed to get her home locally, but neither of the hospitals wanted to take her because she was a surgical patient and not their patient. We had to involve a local MP so we could find a bed for Mum locally so she could start her recovery. The only bed they could find was on a care of the elderly ward that she'd been working on about a year beforehand. She was 58, remember, and being treated as an elderly patient by staff that had no experience of her medical needs. I became very concerned about her mental well-being when she arrived at hospital, and she became very depressed, which really wasn't like my mum, to the extent that I had to ask for her to receive some counselling. It wasn't offered, I had to ask. She went from being fully able-bodied and working as a full-time nurse to being temporarily bedbound and dependent on everybody around her. Counselling was arranged and somebody spoke to Mum. She also spoke to a hospital chaplain, which seemed to give her great comfort. People started to talk to Mum as a human being, not as a patient, and she felt that she was being heard at long last. Some weeks later, she was due to be discharged from the hospital to continue her life as a double amputee. She lived in a bungalow, but of course it wasn't adapted for wheelchair use. Nobody suggested they went to have a look at her home to see if she was able to go and live there. I was again forced to contact an MP who helped us to arrange adaptations to the property promptly. The whole family were involved in arranging the adaptations to the property, and had Mum been sent home without this involvement, she would have become very isolated and unable to navigate her own home. It was funded by the local authorities because, having lost her job, she had no income to pay for the adaptations. Returning home was a relief for Mum, and she seemed to like her new adapted home, and she regained her independence. She suffered a lot from phantom pain and itchy toes. Don't underestimate the pain or the tickly toes. Soon after, she became increasingly dependent on me, and I took over a lot of chores for her in the house, like cleaning. We had a gardener arranged. Mum was never very outspoken. She was a very quiet person, even before her amputation, and as such, I became her advocate and her voice over the next 30 years. Lots of health professionals refused to tend to Mum at home, suggesting that because she had family, we could take her to hospital appointments. I was a full-time working mum, and my brothers were working full-time, and one of them didn't drive, but we managed somehow. In 2001, Mum contracted TB. We tried to get her doctor, GP, to come and visit her at home because she was too poorly to go in, but they wouldn't come. After a few weeks, my brother got very concerned and insisted the doctor attended Mum at home, and they discovered she'd got TB. She was actually in hospital for about 11 weeks. She had TB as a child as well, which was very unfortunate. I will add here that both my children also contracted TB at this time too, because they used to spend a lot of time with her. Again, we felt that neither Mum or we were being heard. Mum had a wonderful GP for many years after her operation. I will mention his name because he's passed away now, Dr. Helliwell. He had great respect for my mum, who was a fellow medical professional. And for 30 years, Mum often had medical students sent to her by her GP and subsequent GPs to talk to her about a complicated medical history. She loved to talk to them. She always stressed to them that patients' feelings always come first, and that was the first thing she talked to them about before she talked about her medical history. Mum relied on outside support to prevent her isolation, such as the library service. She loved to read books, who brought books to her in her home and also became good friends to her. She had a gardener and a cleaner who also became good friends. Food and prescriptions were delivered to home. She became an avid QVC purchaser, and she also had Lifeline, which really was a lifeline to her, because on a few occasions she fell out of her wheelchair trying to pick rhubarb, I might add. All those people became essential to me as her carer, because they would notify me if anything untoward was going on with Mum, because she often told people not to tell me. She received reluctant home visits from her GP after this other doctor retired, and had more than weekly district nurses to monitor her INR levels. She also received remote diabetic nurse appointments, twice yearly visits to a chest clinic, which she relied on hospital transport. Although she was not bedbound, she was homebound and did need help to attend appointments. As I said before, we were all full-time working people, and it was a challenge seeking support from health services for transportation to and from appointments. Eventually, she became quite frail and prone to falls, and she found it really difficult getting in and out of a car. But as she got weaker, she became very reluctant to seek help in the end, because she found it exhausting, constantly fighting for care, and subsequently fell to me as a carer. She didn't want to call her GP surgery because she just felt they didn't care about her. I just wanted to finish by discussing her final admission to hospital in November 2024. By far the worst care that she'd ever received. You'll see on one of the slides that she was actually ready to go, planning her escape on day 2 in hospital. She was an A&E, and I got there and she was packing her bag saying, "I'm off home." She didn't realise how poorly she was. Little did she know that she'd be spending the next 7 weeks there, including Christmas, and wouldn't return home. Sadly, I felt there was such little compassion shown to my mum during the 7 weeks in hospital. On numerous occasions, she reported being shouted at. We witnessed other patients being spoken to poorly on the ward. I did have to intervene at one stage. Seeing such a rapid decline, I asked Matt multiple times if Mum would recover and see it through and come home. Mum always recovered from everything that she had over the last 30 years. I don't know how she made it through that time. On one occasion, when she'd been diagnosed with hospital-induced pneumonia, I asked the nurse if he thought she would see that through, and he just smiled sweetly and said, "She's seen it through before." Now remember, Mum had been the comeback queen, despite being so unwell for many years. I often felt that I was overreacting asking some of these questions. Was I being overly concerned? I asked about palliative care on several occasions. I asked a consultant, a nurse, and her doctor on her penultimate day. Each time my concerns were dismissed because she had a history of bouncing back. When Mum was first admitted, I made the staff aware of a bed sore, but was being made to feel that I was making too much fuss, and they never really took me seriously, or as far as I know, didn't look at it. They eventually did when I insisted that somebody had a look at it because she told me she was in pain. I just feel that due to the delayed care of the wound, especially over the Christmas period where it wasn't looked at for 6 days, the bed sore became a grade 3. I was always told it was a grade 2, but once I got her medical records, I could see from the medical records that it was a grade 3, and she was always in so much pain. Mum experienced delirium for most of the time she was in hospital and was absolutely terrified. She was having hallucinations, but as her family, we were never sat down or given the opportunity to ask questions about delirium. I'm sure as health professionals you know what it's like to see a patient with delirium, but I'd never experienced it. I'd gone from seeing my very intelligent mum that knew exactly what was going on to being really scared and having hallucinations. It was very distressing seeing her like that. And one day I went in to visit her, and I found a leaflet on her table about delirium. And I asked Mum if she understood what the leaflet was about, and her answer to everything by then was, "I don't know." How was a patient with delirium supposed to read about their delirium? It was helpful to me. "I don't know" became her answer to every question asked of her for the last 5 weeks of her life. I tried to address her holistic care when I eventually sat down with a consultant, and the consultant was a little bit flippant about this and told me to take it up with the nursing staff. It wasn't her responsibility. I then arranged an appointment with the matron on the ward, who did admit to failings on the ward and assured me that she would be more present. I never saw her again. If I had questions to ask, I remember they would answer or ask Mum questions, but at that time Mum really had no idea what was going on, so why not look at me and help me by answering my questions? I've always felt like I was being constantly dismissed or ignored. I did mention to them once that she was a nurse, and this did seem to change the attitude, but only for a few days. Another example of being dismissed was my concerns over Mum's medication. She had lots and lots of medication, as you can imagine, and I regularly arrived to find her medication sitting on a pot on the tray in front of her. And when I questioned the nursing staff, they said that she'd told them that she would take it later. But she relied on this medication to keep going. I believe this was the cause of her decline because she wasn't taking routine medication. I also received an apology from the consultant when I spoke to her because Mum should have received some medication on one weekend and repeat blood tests due to high infection markers, but that didn't happen and resulted in acute kidney injury. They were never monitoring her fluids, although I was always told they were. I raised a concern with Call for Concern. I don't know if all hospitals have that organisation, because I was just so distressed at what I saw, and they were amazing, got onto it straight away. I also logged a complaint with the PALS team. I later found out that her fluid and her food was not being monitored. Sometimes she would go without lunch because she hadn't filled in her menu card, so she had no food at all. Then they would bring some food to her in a packet, and she couldn't open it because she was too weak, so she never ate. I never felt that I could trust anybody, so tried to make as many visits as I could to the hospital. Mum was unwashed and not changed for days at a time, despite me asking, and she was wearing dirty clothes a lot of the time. She was also found with no pants on one day during visiting time while my brother went to visit her. Where was the dignity? On the evening of the 7th of January, Mum was very unwell and was moved to another ward due to the fact that she tested positive for hospital-induced influenza. I received a call at 7 a.m. On the following morning to tell me that Mum had been moved to another ward and that the consultant thought that we should go and see her because she was very poorly. I didn't get there. 30 minutes later, she passed away. When we got to the ward, the nurse was surprised that we hadn't had a phone call to let us know that she'd been moved wards. And when I read the PALS report, they decided that apparently it was an inconvenient time to call me, so decided not to, despite Mum being very poorly. It was comforting to see Mum when we did get to the hospital, but my brother and I had been through such a traumatic time, watching her suffer for 7 weeks. At long last, she was at peace. Sorry. Finally, we drove home, and 2 hours later, at home with my brother, I received a phone call from Nurse P, who was on a previous ward, to let me know that Mum had tested positive for hospital-induced influenza and had been transferred to another ward. I replied, "She's dead," and put the phone down. As Mum's carer, I continue to be her voice, and I feel that sadly over 30 years the care she has received became too clinical, and many health facilities were not geared up to cope with a complex patient. No one had time for her, or if I voiced my concerns, this was often ignored, or I was encouraged to speak to somebody else who would pass me on to somebody else. I just felt that no one cared or had time to listen. I'm the voice of my mum. It's not just today, it's been for the last 30 years. I often had to speak up. Mum struggled to defend herself because of her quiet personality. She was a health professional and very aware of what was going on and what should be done. How do other people without this privilege or education or medical literacy manage? My hope is that by listening to me today, you could take 30 seconds to ask your patient and their family, who are you and what do you need? Sorry, I was trying not to get emotional.